Hello everyone, I'm Dr. Hemant Menghani. I'm a pediatric hematologist, oncologist, and a bone marrow transplant physician. That means I take care of blood disorders and cancers which happen in children, and also I'm involved extensively in stem cell or bone marrow transplant for these patients. So my areas of real interest in these is blood cancers in children, blood disorders in children in which blood is not made effectively, and for difficult cases, such cases, to consider stem cell transplantation. That's a very important thing that we deal almost every day in our practice. As I said, I'm a pediatric hematologist too, so I see children with cancers. So sometimes that can be very difficult in terms of dealing these cases, especially with family and their relatives. So my first, so I would rather say that all my cases tend to be difficult cases because it is children who are getting cancers and blood problems. So there is a lot of anxiety. So a large part of my discussion with families and their relatives involves a lot of counseling and reassuring them that once they have this diagnosis, what needs to be done and how can we overcome these diseases. And sometimes while doing them, obviously there are certain families who don't take it as well. So again, in those I sometimes have to do multiple sessions. Over the time, while you deal with such difficult cases, you do need time after you have seen those patients in the late afternoon or evening, so to relax and maybe to wind down a little bit. And whether it affects me or not, that answer, difficult situations in some way or not do affect you. As part of our training and our experience, we tend to get used to these situations, and slowly we find ways of or coping mechanisms where we enjoy ourselves or relax ourselves later in the afternoon or evening, and that's how we kind of make sure that it doesn't affect us too much. Part of dealing with children, there is a good side also. As soon as the children start feeling better, they are a fabulous sight to be with. They are a lot of fun, so you enjoy with them a lot, and that's how you cope with stressful situations, because you have also other patients who are getting better and who are feeling well, who laugh with you, who play with you. So that way I kind of deal with those situations. Again, all my answers will have a little bit of touch of personal or family connection. As I said, I'm a pediatrician by heart, and because being a pediatrician, once my patients do better, they complete their therapy for their cancers and they win over their cancers or they are cured of their cancers, it is big occasion for the whole family, for me personally as well, and the whole team that is involved in their care. So I feel amazing. I feel overjoyed, and I used to think previously that okay, maybe if I keep doing this for a few years, that energy or that excitement will slowly get down, but that actually doesn't. With each patient that gets better, that gets cured, the excitement is even more, the energy is even more, and you feel like all the hard days of work from our side as a medical team, and also from the patient's family, their relatives, is all worth it. And so successfully treating children with cancers is amazing. It gives a lot of joy. And the good thing about cancers and other disorders in children is they have a very high cure rate. So they get most of the cancers in the pediatric age group or in children, they get treated very well. So I sometimes think that I am lucky in that manner, that I see a lot of patients, young patients, surviving their diseases. So in pediatrics, actually, it becomes very hard to pick one. Every child with them, they bring their own set of good things, their own idiosyncrasies, their own laughing mechanisms, their own fun, their own games. And I have a lot of stories, but one that really comes to my mind is about, of a kid which I used to treat about 5-6 years back. This was a kid who was diagnosed with cancer, a blood cancer, while she was about 10 months old, so less than a year. And I started treating her. At that time, when I started treating her, she used to, say common bisyllables like mama, dada, ma. But as I started treating her, the treatment of ALL, one of type of leukemia, is for about 2 years. So by the time she was about 15 or 16 months old, the first complex word or a full word that she said is my surname. And my surname is Menghani. That is very hard to pronounce for many people. Many people say Menghani, Meghani. And she used to say it in her own cute way. She called me Menghani, Dr. Menghani. And she used to say that while all through the time she was in the OPD and in daycare, all the nurses used to have a laugh. I used to have a laugh. So mom used to comment me and say to me that I am jealous of you, that the first real complex word that she has spoken is your name, and that too in a very funny tone. There are lots and lots of such stories to tell, and I think this platform might be short to give you a whole sequence of them, but this one really touches my heart. She's now, as I said, this was 5-6 years back. She's now about 6 years old and is doing fine. When she comes to meet us also, we have a laugh about this, and she doesn't believe me that the first words that she really spoke, the single word was my surname in a funny way. So I like that, yes.